Good morning.
Good morning.
How are you?
Good, how are you?
Doing well.
Good.
Just figured out that molasses is sugar.
Lots of sugar.
Yeah, so I've got a little forehead ache.
They're
But now
great
that I know
cookies.
that that's what it's from, I'm more comfortable.
There you go.
How big were these molasses cookies?
The size of your head, I'm telling
Wow.
you, they were huge. You need
Oh.
two hands to.
Ann is the maternal infant health program coordinator with the health department. And as we've learned over the years, the health department has a lot of children's health services, health care services. What are they? How do you define what the special health care services are for children?
Yeah, our Children's Special Health Care Program, it is designed for children and young adults.
Okay.
It goes up to age 26 who have a chronic health condition. And there are 2,700 diagnoses that
Oh, wow.
qualify
Wow.
for this program. So it's really unique how one can become involved. Not anyone can just apply to be enrolled in the program. They have to be invited.
Okay.
So based on the diagnosis from a specialist, we then do a medical records request, and that gets sent up to the state of Michigan for
Okay.
the doctors at the state to review, and then they determine whether or not a child would be eligible for
Okay.
services. And if it is determined that they're eligible, then they can choose to enroll. They get
Okay.
sent some information, and then there's paperwork and
So,
things that
so the
have to be-
families, they won't apply, or can they inquire?
They can, yeah, and we do get calls,
Okay.
about, interest, and we can help lead them in the right direction. But the key thing is seeing a specialist.
Okay.
Yeah, that's like kind of the starting point.
Sounds like a lot of rigmarole. You got to get the specialist has to make an application to the state, and then the state has to review, then it gets back and gets invited. It sounds like it could be a time-consuming process.
It can be, but we have wonderful nurses who, provide support in that department, in that program, and help I'm totally losing my words right now. They guide them through that
Sure.
process. Sorry.
And
Well, Ann's excited about Valentine's weekend because she's got a getaway planned.
I'm jealous of this, by the way.
Yeah, it's nice to get out of town.
Everyone needs to get out of town, especially with this weather we've been having, although it is a little bit nicer this week. You said there's over 2,700 diagnoses?
Yes.
That's amazing. What support is the most common that you guys are providing within this program, would you say?
Our nursing case management. So we have
Okay.
2 nurses that work in the program, and we can either meet with the family in their home, or we can do what we call our plans of care over the phone. And the nurses just, talk about their medical history. What does that look like? What is treatment looking like? Disease progression, disease management. When young people are kind of transitioning into adolescence and young adulthood, what does that look like in terms of their self-care as they get older, and learning how to manage, what their challenges are.
And how long are some people in this program up until they turn 26? And are you able to stay in that program once you receive the offer?
Yes, yeah. So there are a couple or a few diagnoses that are lifelong. So
Okay.
bleeding disorders, sickle cell, and cystic fibrosis.
Okay.
So those diagnoses do qualify for lifetime coverage.
Do you have to be low income to be invited into the program?
No, it is not an income-based program. So whether you have private or public health insurance, anybody is eligible. Depending on family income, there could be some fees that are associated with the program, but that's another process, that families have to go through.
You look at some of the potential services, just x-rays and things that, you're really helping these folks not only get better, but saving a lot of money really if they're eligible for these programs.
Yeah, there's definitely some supports in terms of even like durable medical equipment, that
Sure.
can help be covered. We can help connect with resources. Maybe somebody is wheelchair bound and needs assistance in getting a ramp installed into their home, things of that nature.
wow.
Those are things that are possibilities, and making referrals to community resources as well.
Does your team actually provide the services, or do you just arrange and cover those?
We make arrangements.
Okay.
Yeah, yep. We would help connect them to where they need to go to see if they would qualify for that extra support.
Are there many children in Jackson County that are part of this program right now?
Quite a few, over 900
Wow.
are enrolled in this program.
Wow, that's amazing. It's
Yeah.
great impact right here.
Yes, yeah, for sure. And it's all throughout the state too.
Okay.
Yep, and it is, other states, it is like kind of a nationwide program, but it may be identified under a different, title. So here in Jackson, in Michigan, it's Children's Special Healthcare Services.
Well, with that many diagnoses that would be covered, if there's health issues in your family with your children, you should check, because it's possible you can
never know.
take advantage of this.
Yeah, anybody can call that number on the screen, 517-788-4422. Or if you want to visit the health department website, you can scan the QR code, and that takes you directly to the program's webpage.
And you have so many resources available on the website for all areas of the health department that people can check out.
Yes.
We appreciate learning about this today from you, Ann. Thanks for coming in.
Thank you so much. Thank you for having me.
Yeah, have a great weekend.
You too. Thank you.
Community Health Coordinator and Maternal Infant Health Program Coordinator at the Jackson County Health Department, Ann McClure. More of the morning show after this.